Hello, my name is Pat Bohse, and I will be the host today for our program called Welcome to SCAN. And I am really pleased and privileged to have with us Donna Hlavacek, who is a financial service expert employed by one of the large insurance and financial service firms. And she also is a regular contributor to the Monmouth County Women magazine, addressing topics on insurance and retirement. The November-December issue addressed the topic of avoiding your own personal financial crisis. Welcome.
Thank you.
I'm really excited about talking about this topic. So before we start talking about financial literacy, tell me a little more about you.
Okay. Well, I'm also a member of NAFA, which is the National Association of Financial and Insurance Advisors.
That was a mouthful.
And yes, I usually use NAFA. And I'm on the board of directors for Monmouth Ocean chapter. In 2004, when I transitioned to my current career in financial services, I became licensed for life, health, and variable products. And subsequent to that, I obtained my Series 7 General Securities license, my Series 63 and 65, which allows me to practice as an investment advisor representative in multiple states. I've earned the advanced industry designation of CASEL, Chartered Advisor to Financial Living, CASEL, Chartered Advisor to Senior Living from the American College. This designation meets the regulatory requirements in all 50 states in the Union and allows me to cover topics such as retirement savings, structured distributions from pensions, 401ks, 403bs, IRAs, Social Security choices, as well as planning for health and long-term care needs during retirement.
So I'm then very, very happy that you are on our advisory group for take control of your, not only take control of your health you're going to work us with, but financial literacy for older men and women too.
Yes. As
you know, that we are rolling out 3 signature programs this year at SCAN, and one of them is financial literacy for older men and women too. The reason we're doing that is I've been in the industry for 25 years as far as the field of aging, but since I've been here at SCAN for the last 2.5 wonderful years, it's just become really obvious that so many people need help in this area, and there's so many questions between Social Security, Medicare, Medicaid, I'm outliving my savings, and what am I supposed to do? And people just really struggling, especially with the economy, and there's no growth, and no matter where they put their money, it's not seeming to last as long as they expect it. So I'm happy to have you on our team.
Oh, thank you.
So with that said, I really wanted to spend the next 15 minutes that we have for the show to kind of give a preview of what we're going to be doing when we take our act on the road. We've developed right now 2 workshops that we will provide at SCAN, but also in the community, and one is called Your Future Paycheck, and that's really geared to people who've not retired yet. As you know, SCAN membership is for those who are 50 and over. And what we're finding is that even when people reach 65, which used to be the traditional retirement age, that they either can't or won't retire. Right. And so there's just a lot of good information that they should be having to get ready for retirement.
Absolutely.
And then the other one, which we're delivering next week, yay, is called A Day Late and a Dollar Short. And that's really geared to people who have retired, who underestimated what it costs to live, especially in Monmouth and Ocean County, which is very expensive, and also what some of the options are to either save money or get some additional dollars. So welcome.
Thank you.
So let's talk about what is financial literacy. I mean, it's just 2 big words to some people.
Yes. I mean, according to the American Society on Aging, one definition, and talk about a mouthful, it's the knowledge of basic financial investment concepts such as inflation and risk diversification and the capacity to do calculations related to interest rates. It's crazy. I have a simpler definition.
Okay.
Okay. Financial literacy is understanding the terminology and uses of the basic tools of finance, CDs, mutual funds, IRAs, your Social Security choices, healthcare planning, the effects of inflation on living a long life.
And I think that was the aha moment for me when you and I started working on a lot of this data, was the inflation piece. I mean, you had shared with me whatever I have now, double it when I'm about 80, and that scared me a lot.
Yeah. Part of the challenge of working with retirement and the distribution of income in retirement is that moving target of how long do I have to plan for. I have a personal bias to plan for longevity. My grandmother lived to be 104. My parents are both in their mid-80s. People talk about averages, but an average can be very deceptive. My grandmother was 104 when she passed. My grandfather was 77. That average age was 87. So how do you plan for the two pieces?
I don't know, but you're going to help us find out as we go forward. Implementing this program of financial literacy, what do you believe are who is the important audience that we should be talking to, or some of our presentations will be geared to?
Well, if we take the over 65 demographic, we talk to women primarily. That the program is focused with women as the primary focus. And that's because not we like women better, or we are women, but because women, first of all, statistically do tend to live a longer life. Statistically, we've earned less money over our lifetimes. We've taken time off to raise children. We've worked in part-time or lower-paying service jobs. So our Social Security benefit, which is about 45% of our income in retirement for a vast majority of retirees, is significantly lower than that of the Social Security benefit for men. We tend to have larger health care costs in aging because of the longevity, because of osteoporosis. We tend to be primary caregivers in our family, which has a significant impact on our economics. So there's a lot of reasons why women need to focus on financial literacy in the retirement period.
And it doesn't have to be painful. I mean,
no.
Sometimes, again, when I start talking about the subject, sometimes people get that glazed look in their eyes, versus being very pokey or paying attention to the topic just because it's uncomfortable or it's not stuff that they've talked about in the past. And so I just really want to make this opportunity something that people will not be afraid of,
Right.
that they'll embrace and that they'll have fun with. I mean, some of the news might not be so glamorous, but if at least I know what the rules of the game is, then I can at least play the game or adjust the game in regards to make sure that I'm okay going forward.
Absolutely. And financial literacy, the terminology that so many people have confronted over the years does have that eye-glazing effect on people. But we're talking about, some concepts that are as simple as, in many cases, once a surviving spouse is left to manage their money, they're not the one that balanced the basic checkbook at home. So what are the basic banking concepts? How do you balance your checkbook? What do you need to do to decide whether you should be paying off credit card debt or mortgage interest rate first? We find that people that have a better understanding of the concepts of financial literacy do a couple of things. They plan better. They make better investment choices. They have better credit scores. They are able to plan for health care costs and meet some of the contingencies that arise in retirement much better than people who are afraid of and are not familiar with some of these basic concepts.
So let me just back up. We are calling this financial literacy for older women and men too, because the same thing goes in reverse, especially if a man was not necessarily the breadwinner, but didn't pay the bills or take care of the checkbook. I have to say that my dad never wrote a check in his life until my mom got sick. And he never used a credit card. He learned how to use that fast, but never did that before. And then, so it's the same thing in reverse. So we're not just saying that it's for women only.
Oh, absolutely. And perception-wise, people frequently think that the husband or the male in the family is the financial the handler of the finances in the family, but that is not true in probably 50% of the cases. So definitely this is for both.
So I want to go back to some of this average stuff. In our notes, what I'm seeing here is that the average Social Security payment for a man who is 65 might be getting about $15,795. Now, I'm not sure who can retire on that, but and again, I don't think Social Security was meant for the only piece of retirement planning or savings. And for women, same demographic, 65, they would only be getting $12,188. I mean, that's like $1,000 a month. I mean, how do you live on that? How do you pay rent, and how do you find food? And so the other thing that we're planning to do in our classes is bring to the table all of the other resources that are available through the community, whether it's from the federal government, state, or local, so that at least people have a place to go to get some good information and to see if they're qualified for different programs.
Absolutely. I mean, one of the pieces that drew me to SCAN as an outlet for this kind of information is the ability for people to approach SCAN or an organization like SCAN for a safe, neutral place for the educational materials, the resources that they need, someone who has done the legwork of where to go to the government agencies and how to access that information, and maybe even walk them through some of it.
Yeah. Again, we don't have any social services here or social workers, but we do have a lot of good phone numbers, and we can get to the right people at the right time.
Absolutely.
So I'm excited about that. So let's go on with some of the other things that we're talking about. How would individuals apply for some of the financial literacy concepts, apply them to daily living?
Well, let's take the credit cards that we spoke of earlier. I've run into the situation where people are making double payments on their mortgage interest rate and yet carrying minimal balance or just making minimal payments on their credit cards. Credit card debt is something that does not purchase anything. It is not beneficial in almost any way, the interest rate that you're paying on a credit card. So the actual reverse should be happening there, where the credit card balance should be paid down before, and that will increase the cash flow right there. The other thing that people don't realize is the difference between a credit card and a debit card. People don't realize credit can be used, it's a very useful tool when it's used correctly, and there are a lot of federal law protections for fraudulent credit card transactions. So much of that has been in the news recently. And with the stores that we all use on a daily basis, if you listen carefully to the news, they're talking about the debit card transactions. Debit card transactions do not enjoy the same protections in terms of recovering fraudulent transaction
And that
charges.
was news to me when I heard that we were talking about it. The other thing that I think when we talk about, again, some of those benefits like Social Security, I don't think anyone ever talks about the tax that you have to pay on that money.
Sure.
It's not free.
No. It's kind of like those IRA distributions. The taxes come due. And depending on how you take your distributions from hopefully you are fortunate enough to have other retirement savings, but how you take those distributions will affect your Social Security. A lot of people don't realize, for instance, that tax-free mutual fund that you have, the tax-free municipal bond fund, that interest is a calculation towards making your Social Security taxable.
Right, and then the other thing about Social Security, I mean, I just feel so smart. I've gone to some classes lately, is the whole thing in regards to spouses, being able to use or collect from your spouse's Social Security depending on how high it is or what the difference is.
Yeah, I'm a strong believer that nobody should go into retirement without some sort of advice coming to them. Do you take your Social Security at the reduced benefit of 62? What is a suspend or apply and suspend for your Social Security? What is taking the spousal benefit and the other spouse waiting until full retirement age or age 70 when it stops to accumulate? If you treat Social Security like an investment, you're getting an 8% return from your full retirement age to age 70. Would you disrupt that in any other kind of investment?
Well, after I saw the numbers, I guess I'm going to hang out and scan until I'm 70 because the numbers were huge. They were
Yeah.
just really so much higher. So we have about 5 minutes left. Let's talk a little bit. I mean, because when we look at financial literacy, I mean, one is income, and we're talking about that in other ways, and the other piece is people are working longer, whether it's part-time or full-time, to make ends meet. Now we're talking about health care or Medicare. Again, that's not free.
No. No.
So let's talk a little bit about that, and then the third leg of the stool.
Okay. Well, Medicare, when you apply for Social Security and you start getting your Social Security check, the government will be so kind as to automatically deduct about $104 each month from your Social Security check, and that is for Medicare. Medicare pays for about 80% of your medical costs in retirement. A lot of people don't realize that. Many people will turn to a supplemental supplemental Medicare plan to augment the medical coverage. A couple who is age 65 should plan, a normal healthy couple, no special medical costs, can actually plan to spend $263,000 during a 20-year retirement for normal medical costs and expenses. That can be a frightening number.
Yeah, big time.
Yeah.
And especially if you never thought about it or planned for it.
Right.
And that's why we see people going into poverty 1 or 2 years after their spouses pass away.
I believe the statistic is in about 40% of the cases, a surviving spouse will be in poverty within 1 year of losing their spouse.
Right. So that's not fun.
No.
But again, this is really good information, and if I have it, then I can at least plan for it, and I don't like surprises.
No, the best thing to do is to have this information up front, make a plan, be aware, be educated, be able to make choices that as you go forward through retirement, the choices you make at the beginning of retirement really are irrevocable and will affect you for the next 20 or 30 years. I tell people all the time, when we're 20 and 30 and 40 and we mess up, we have time to fix it. But when you get to retirement, if you make a wrong choice, in many cases it's not something that can be fixed.
So with that said, the other leg of the stool really has to do with long-term care. And so what are some of the statistics there?
Long-term care, about 60% of the people will need long-term care at some point in their life, and long-term care is a specific connotation. It's custodial care. Medicare does not address...
Could you say that one more time?
Medicare does not address custodial care.
Yeah.
What does custodial care mean? That means that you're not going to recover from it. So if you fall and you break a hip and you will mend, then Medicare will probably cover most of those costs. However, if you fall and you hit your head on a step or a sidewalk and you are judged not to be rehabilitative, Medicare will stop immediately and is no longer covering those costs.
And again, I don't think people realize that. They think that they have 100 days no matter what, whether they get better or show improvement or not, and that's not so.
Right.
So once they're deemed that they're not getting better, then Medicare really kind of puts you off their program.
Yeah, that's correct.
So we have about a minute left.
Okay.
So I know that scams, and we don't have time to talk about them, that they're out there, they're wild and crazy. We will be talking about that in our workshop, though. We've been working feverishly on updating our presentations. We're going to be delivering them in the community starting in a week or two. And if there's one last thing that you would like the audience to know about, what would that be?
Well, let's talk about the financial scam. It hits as close to home as my mother called me last night and told me she got one of the "Grandma, I'm in trouble, can you wire me money" calls.
Oh, goodness.
So the better educated you are, the more prepared you are, the less likely you are to fall to those financial scams.
Yeah, and we're hearing a lot of those. So, you know, if the grandkids call, don't say too bad. And the other issue is really giving your children and your grandchildren some of your savings. It really affects your retirement package completely.
Absolutely. That's your retirement income, and you're not going out and working overtime to make up for the money that you give to the kids.
And I know that sounds terrible, but we're really going to push that. So I really want to take this opportunity and thank you, and I'm really looking forward to our joint venture together. We have a wonderful team coming together, so thank you very much.
Oh, you're welcome. I am so looking forward to it.
Take it from me. Living with a chronic disease is no easy task, but I learned to better manage my health condition, and you can too. Take Control of Your Health is the chronic disease self-management program created by Stanford University. This fun, innovative course is now offered to all county residents. Diabetes, arthritis, heart disease, cancer. Take Control of Your Health gives proven strategies to manage these conditions and reclaim your life. See how nutrition, exercise, and various mind techniques can help you overcome depression, increase energy, and manage pain. You'll not only get this book when you participate, you'll also receive the guidance and support of others living with a chronic illness, just like you. Take control of your health in 6 short sessions.
Call the number on your screen to register or get further information at scannj.com. Brought to you by SCAN, Social Community Activities Network, with funding made available by the Monmouth County Office on Aging.
Welcome back. My name is Pat Bohse, and I am the host of Welcome to SCAN. With me right now is Andrea Tarr, who is the program director for SCAN. Welcome.
Hey Pat, how are you?
I'm great. I'm really, we had a wonderful guest just now talking about financial literacy. It was one of our signature programs that we'll be rolling out.
Yes.
And she was filled with wonderful information, and I think it's going to be a great program for us this year. And I'm looking forward to helping take it on the road.
Yeah.
And see if we can help people get them some really good information that they can better plan their future. So with that said, so tell me what's happening here at SCAN.
What's happening? Well, we're getting ready for another general membership meeting towards the end of May.
So what is that in regards to what do we do usually at those meetings? Because the audience might not know.
Yes, the audience might not know. It's an opportunity for really members and even non-members. Anyone is welcome to join us. And it's just a way of letting you know what's happening at SCAN. We'll generally have a guest speaker. And we do have lunch.
We do have lunch.
We do have
I learned
lunch.
many years ago to make something really successful.
Food.
Food, cheap, free, and food. So we had a wonderful, we've had really good turnouts for our membership
Yeah, we
meetings.
have. We've had a good 50 people at the last few, and so I see no reason to think this would be any different.
Great.
But it's just a great opportunity to get to see, to meet some of the other SCAN members, see what's happening.
Great.
And so that's coming up at the end of May. Our spring and summer semester is going to be starting in the beginning of May. And so that will be, a whole new opportunity to take classes. Hopefully something a little bit different. We're going to try making it a little more similar to our Boscov campus of courses, in that we're planning on having a lot more of these one-and-done kind of classes, a lot more variety. A little bit
Yes.
different.
And we're considering reprogramming the catalog.
Yes.
And so we're not sure how that's going, so we won't let the cat out of the bag.
Right.
But we're hoping
You'll
to
know
get
when we know.
get the information out to everyone really quickly and sooner. Hopefully we might be able to put some major ads in the newspapers for people to register. They seem to go really well for us.
Yeah, we will try and make this a much more efficient way of delivering information. But meanwhile, the information is always available the minute it's ready. It's always on our website.
Which
So
is?
Which is www.scannj.com.
Great.
And I definitely encourage everyone to look at the website as your first line of defense, because anything that happens gets done on the website very quickly. You don't have to wait.
And I appreciate that, but in the same token, we're very conscious that not everyone
Yes,
uses the website
we know
or
that.
computers. So we're really trying to be diligent about providing the information in all different mediums.
Yes.
So we're conscious of that.
Yes, absolutely, absolutely. So we also have, coming up on May 14th is our annual health fair, and that's always great. We have it here in the mall, have about 40 vendors, and lots of interesting things usually happen during the health fair.
Yeah, we're hoping to plan some surprises. I don't know what they are yet, or I won't let them out of the bag, but I'm hoping that people will stop in. I think our fair usually runs from 11 to 3, and we have lots of health screenings, and
Yeah.
we'll be giving away a lot of goodies and some prizes, so hopefully people will stop in.
There's always a lot of activity during the health fair. And we still have, in conjunction with the food bank, up until April 12th is the VITA program, which is a free tax preparation for eligible people.
And that's been going really well.
Yes, yes, and we're happy with our association with the food bank. But it's walk-in service, but to find out if you're eligible, I would encourage everyone to call the food bank. And you can easily get a link probably on our website, or it's the food bank of Monmouth and Ocean counties, and they can give you all the information that you would actually need. Also, we're working with the food bank. They are certified navigators in for the new health care, the Obamacare, and they come to SCAN periodically to help enroll people and explain what insurance is right for you and give you all your options. And again, I encourage people to call them, and even though it's walk-in service, you might want to just make sure you're eligible, and there are some bits of information you do need to have with you.
Great.
So that's all happening. And of course, I always like to remind everyone that SCAN is open to the general public. We are a members organization, but anyone is welcome to come to a class.
And we are seeing lots of new people come through the doors.
We are, which is a good thing. We really saw that at our general membership meeting. A lot of people that we had never seen before, and then they've gone on to register for other things.
And if I heard it once, I've heard it 1,000 times. Where have you been all my life?
Where have you been? I
And
know.
so for the last 25 years, right here, and for the next 25, right here, but also in the community.
Yes, yes.
So what if you become a member of SCAN, what do you get?
Well, it's $30 the first time to be a member, and then a $15 annual renewal. But the perks of membership would be that you can take classes at a lower rate. And we do have some coupons periodically through the mall for some discounts. But I think one of the best parts is twice a year when we do our Boscov campus of courses in the fall and in the winter, members can take an unlimited amount of free classes, which
The
is
other
great.
is that we will be doing our brain health fair this year.
Oh, yes.
And again, it's free to members, and that was a huge success last year.
Yes.
So I'm encouraging people to join. And if you come in during the semester and like a class, everything gets prorated. So
Yes.
people should know that.
Right, you shouldn't feel that it started already and it's too late for you to start.
So we have 30 seconds left. The signature programs that we're rolling out. And
Take control of your health, brain fitness, and financial literacy for older women and men too.
Yes, and the brain health has really been a signature program for many years for SCAN. I think that everyone who takes classes here have been keeping their brain healthy,
Yes.
Mentally, emotionally, spiritually, and physically. So, I mean, I think we've been practicing that for a long time and just never
Before we knew the
promoting it.
words.
Right, exactly. So I want to thank you for all the work that you do and all of your volunteers and
You're
the
welcome.
staff that work with you, because you do great stuff. So if it's important to you, it's important to us, please let us know what you would like in the future. Thank you.
How to locate SCAN. SCAN is easy to locate once you find the movie theater at Monmouth Mall. As you enter the parking lot from Route 35, the theater is almost directly ahead of you. Drive towards the theater, but go up along the left side into the parking lot. As you approach the end, you will see entrance number 3 on your right. Park and enter the building here. Once inside, you will see a staircase that only goes down. After passing through the doors at the bottom, turn to your left, and SCAN is right there.